observed that there's been an overall increase on the continent of 4.8%. And the regions, respective regions, read as follows: an increase of 17% in Central Africa, 6% in East Africa, 3% increase in North Africa, 12% increase in Southern Africa, and 1% increase in West Africa. So there have been increases across the board in all 5 geographic regions of the continent. Over the last 4 epidemiological weeks, we have noted the following trends for the most populous countries in Africa. New cases include 2% increase in Nigeria, 4% increase in Ethiopia, decrease in Ethiopia, 21% increase in Egypt, 27% increase in the Democratic Republic of Congo, 17% increase in South Africa, and no change in Kenya. So those are the rates as per the most populous countries. When you look at the new deaths, the numbers look as follows. Nigeria has recorded over the last 4 epidemiological weeks, 11% average decrease. Ethiopia, 7% average increase. Egypt, 10% average increase. The Democratic Republic of Congo, over 100% increase. South Africa, 10% increase, and Kenya, 4% decrease. We continue to support member states to build their capacity in several areas, including infection control, begin to address mental health issues, completing training using the new antigen test. So this is the test, as I've explained previously, that will enable us to pick up the virus. And we also are looking at biosafety and biosecurity issues in Zimbabwe and Eswatini. Let me now transition to the testing. As of today, the continent has recorded a total of 22 million tests conducted, and that represents a 2.2% increase over the last week. The 10 countries that are conducting over 70% of the testing include South Africa, Morocco, Ethiopia, Egypt, Kenya, Ghana, Nigeria, Rwanda, Uganda, and Cameroon. As I indicated last week, 2.7 million tests, additional tests have been procured by the Africa CDC for member states to be distributed by member states. Let me now transition to the vaccines. As we discussed last week, President Ramaphosa, who is the president of South Africa, the current chair of the African Union, established the African Vaccine Acquisition Task Force as part of our strategic plan for vaccine development and acquisition. And this task force is the ARVAC, as it is called, is the African Vaccine Acquisition Task Force, is supporting the development of a harmonized and expedited continental regulatory process for market authorization for successful vaccines. It will issue guidance on approval processes for national regulatory authorities and member states, assurances to prevent delays in adoption of those regulatory processes, which fits into the third pillar of our strategy, which talks about delivery of the vaccines to the continent. We're also working closely with and in discussions with the World Bank and the Afri-Exim Bank to raise additional resources to acquire enough vaccines for the continent, recognizing what the COVID facility is doing. On other information, we know that one of the greatest obstacles we are facing on the continent is misinformation. And this will also have impact on the vaccines uptake. And I'm pleased to announce that at 3 African time today, the World Health Organization office in Brazzaville and the Africa CDC will be launching the Africa Infodemic Response Alliance in the area And this is an important, I invite all of you to attend, because it's very important that we collectively work to establish correct and accurate information. Let me just conclude then by sharing some reflections in the DRC. As I indicated earlier, the government of the Democratic Republic of Congo did an amazing job in the number of infections, which plateaued around June, July timeframe, and then declined steadily. But as in other countries in Africa, we see that we are beginning to have steady increases. So I think because of that, we've been discussing with the authorities, including Professor Muyembe, whom I hope will be here shortly. We will be discussing we have been discussing with the Minister of Health, the President's Special Advisor and coordinator, overall coordinator of the COVID response, and meeting with the WHO office here in Kinshasa, meeting with the AU diplomats accredited here in Kinshasa and other partners at the World Bank. I think overall, there are a few messages that I would like to, observations that I would like to share with you, that like many parts of the continent, many countries in Africa, we see that there's truly prevention fatigue, where the rate and level of masking is reduced, and I would say significantly reduced. This is not unique for DRC. We've seen that in other countries that we have visited. That is one. Second thing is that we have to begin to prepare for the year festivities with the prospects, the real prospects that as people congregate for the end of year festivities, we really will expect that the number of new cases will increase around January and February timeline. And that means we have to have an honest conversation and a hard discussion as to what do we do. That is the political engagement that needs to step up and have a conversation with the public, an honest conversation as to why we should behave differently during this period of the festivities coming up, because the virus clearly is coming up in terms of the second wave. We are also very excited that the Professor Muyembe's lab, that is the Institute of National Research, Biomedical Research, is up to it. I mean, they are really active doing scaling up testing and doing full genomic sequencing. They've contributed, I would say, they are the second center in terms of contributing genomic sequencing across the continent, just behind South Africa. So I think we are very pleased to observe that, and the enormous capacity and capabilities that exist within the center. I really hope that in course of this dialogue, you'll be able to join us. And lastly, is really the strong political will of the openness of the leadership to discuss and listen attentively to new suggestions. We've also learned from the leadership on the hardship that the lockdown imposed on the population, and the ways that this could be done, and balance with the balance in between saving lives and saving the economies. The impact was significant. And really, lastly, that most of the epidemic that we are seeing, or pandemic, is concentrated around Kinshasa, and majoritarily around Kinshasa. And there are 4 provinces that have not recorded a case, which is a very, very, very good news. I think that is that needs to be celebrated. But strategies that target Kinshasa to especially certain districts in Kinshasa, like the Gombe, is extremely important. Let me end here, Wayne, and turn it back to you so that we can have a more open and lively discussion.
Thank you very much, John. And we can see in the backdrop there, colleagues from the Africa CDC are really showing us that they are doing work there on the ground. Now, we are going into our question and answer session, and I just want to thank the journalists who are with us today. I recognize quite a number of names who are joining us live, as well as the Deputy Director of the Africa CDC, Dr. Ahmed Ogwell Omar. Thank you for joining us. So the first question that we have is coming from Paul Adepoju. And Paul is with Devex and Lancet, and he's joining us live. Paul, good morning. Hello, good morning, Paul. I can see that your microphone is
Hello. Hello, good morning. Can you hear me now?
Yes, I can hear you. Please go ahead.
Yeah, thank you very much for these enlightening sessions. So I have 2 questions for you. The first question is that we are aware that the UK became the first country across the world to approve the COVID-19 vaccine, and it resulted in a major protest in which people arguing over whether the vaccine is safe or not. So the first part of my question for you, sir, is that what is your view, what is your official comment regarding UK's approval of this vaccine? And the second part of the question is what lesson do you think the outcome of this announcement the Africa CDC has learned to ensure that when the vaccine eventually becomes available in Africa, people fully trust that they can accept the vaccine and that it is safe for them and effective? Thank you very much.
Yeah, so thank you. First of all, the vaccine that the UK government approved is the Pfizer vaccine, which has gone through all 3 phases of trials. That is the phase 1. The phase 1 trial looked at the small number of subjects or people and establish the safety. That is the very first thing you do in clinical trials for vaccines, is to establish safety. And then phase 2, you expand that safety and you start testing different populations. And then you move to phase 3, which is the efficacy, the effectiveness of the vaccine. So this vaccine, I want everyone to be very clear and be on the same phase, has gone through all 3 phases there. So there are no issues of safety. There are no issues of efficacy. I think we heard prior to this announcement by the British that the vaccine was around 95% efficacious. I think that is the way. So it means, and this is on a large number of people that took part in clinical trials. And the data is open. I mean, the safety data is very, very is open for everyone. The WHO has all the data. Let me just say this, that in terms of trust, if I had my way today to take a flight to the UK and get that vaccine, I will be doing it right now. I want to also assure the population of Africa that we, Africa CDC, will work closely with WHO to make sure that the vaccines that come to the continent have been fully tested and are effective. No substandard vaccines will be used in Africa. If the vaccine comes to Africa today, I will be the first person me and my family, to be vaccinated, just to show you the level of confidence that I have in this vaccine. And just to also make sure that we understand that vaccines are not, this is not new. This is not the first time that the continent will be dealing with vaccines against any infectious diseases. We have survived as a people thanks to vaccination. I think personally, I've received over 7 different vaccines over my lifetime from childhood to now. And we are all healthy. Vaccines are the most potent public health tools that we have, and that the history of infectious diseases have ever had. So we should be very fortunate. But let me just end by saying that the continent should be assured that your organization, the Africa CDC, is working very hard to ensure that only the best vaccines are introduced on the continent.
Thank you very much. Next up is Olivia Kumwenda. And Olivia is with Reuters News, and she says, what is the main trend with COVID-19 cases on the continent? Secondly, she says, are cases rising in a number of countries because governments have eased on their lockdowns? And then thirdly, is there now a demonstrated spread from the large cities to smaller towns and rural areas in Africa? And then finally, what is the impact of that in terms of cases and mortality? So those are 4 questions from Olivia Kumwenda from Reuters News.
So thank you. Let me start with the trends. As I indicated earlier, the trends, we saw the continent as a whole peak around, that is the number of COVID cases, peak around July, August timeframe, where we're recording about 14,000 new cases a day. And then that number decreased steadily to around September or October, where it plateaued a little bit, and we were recording about 7,000 new cases a day. And we have now seen that the numbers are coming up to about 10,000 or 12,000 daily cases. So it is my expectation that that number will continue to increase, maybe in the next 2 months. Again, that is why the next 2 months are critical for us, because the continent as a whole will go into a holiday season, and that will mean people will be interacting more and will be on leave or holidays. And my fear is that we'll peak. We'll probably have the same peak as in July or August, around the coming weeks or the coming months. So I think that is the overall trend. Now, if you look at the continent as a whole, I mean, we all know that Africa is, as I like to call it, is the continent country. So it's very difficult to look at. We use the word Africa, but of course we are a combination of 55 member states. Some countries have never actually gone past the first wave. And if we go look at countries like Tunisia, Morocco, Libya, the curve has been increasing. Some other countries have actually seen dramatic decreases, like Kenya, and we now see a worrying curve going up. And many countries are in that category. And some countries, of course, have continued to see a steady decrease. I just mentioned Ethiopia. We continue to see a steady decrease there. So it's at times, it's important to discuss the continent as a whole, but also unpack the continent so that we look at regional trends and individual country trends. We are very pleased with what we are seeing in Nigeria, a country of over 200 million people. We should have to always step back and say, what if the pandemic took off in a country like Nigeria or Ethiopia, Egypt, or the Democratic Republic of Congo, as it did in Brazil or in India? We will be in a very, very difficult position. So I think I really want to give a shout out of congratulations to those countries, large countries in Africa that have really worked hard to maintain the level of the pandemic where it is. Are we out of the wood yet? No, not at all. So because of the balancing act between easing the lockdown so that economic activities can prevail, and we all know that majority of our employment is informal, and we couldn't possibly lock down forever. As you ease the lockdown, you see that there will be increases. If you actually extrapolate Google Maps and with the changing patterns of COVID in certain countries, you really see nicely that as people move around more, you continue to see increases. We expect that. The purpose of lockdown was never to use that as a tool to permanently control the pandemic. The purpose of the lockdown is actually to get ourselves prepared. And I must say that we are better prepared today, 11 months in the pandemic, than we were 11 months ago. That is in the January, February timeline, where we had no diagnostics, we had no PPEs, and we just didn't even know the virus. Now we know the virus, we know how to manage patients. And if you look at our mortality rate at that time and compare it now, it has decreased significantly and actually stabilized around 2.4% across the continent. With respect to movement of cases from large cities to remote areas, that is our greatest fear now. You see, there's a tendency that you see a lot of that now during the holiday seasons, because there will be a tendency for large movement from the capital cities to the villages, remote areas, for people to connect with their families and in the traditional end of year celebrations. And that might drive the pandemic. What this suggests to us is that as part of a second wave, we strongly recommend that national governments enhance their ability for surveillance. Okay, that is what, especially in the remote areas, that is where the battle will shift, because the infections will to those remote areas. With respect to mortality, as I've indicated, as we learn more about this virus, we keep improving on the ability to manage the cases, and also that improves on the mortality. The mortality in certain countries, including in DRC, was very high early on, but as the country keep improving its case management and also learn more about the virus, we see that it decreased significantly. That is one of the big lessons that we learn from here. They've increased and decreased the mortality to around 2% and stabilized it at that point. So I think those are the 4 questions that we asked from the colleague from the media.
All right, next up we have questions from Cara Anna from Associated Press. Thank you for the briefing. You have said you prefer that African nations collectively pursue vaccines, but which member countries so far have decided to pursue vaccines for themselves? And does that hurt the collective effort? That's from Cara Anna.
Yeah, I think, Cara, as if you deal with any what I call the collectivity mechanisms, there's always bound to be the challenges. And in as much as we've done and established a strategy for the continent, a continental strategy for vaccines, in as much as we've engaged and set up those, President Ramaphosa, the chair of the AVAC, it doesn't negate the fact that countries will behave differently. And we have seen, I've read in the news that Morocco is looking